Anterior cingulate gyrus functions. Running lengthwise through the deep aspects of the frontal lobes is the anterior cingulate gyrus. It is a major switching area in the brain, with many fibers traveling through it to other destinations in the brain. We think of it as the brain's gear shifter, as grease for human behavior, allowing us to be flexible, adaptable, and to change as change is needed. It allows you to shift your attention from thing to thing, to move from idea to idea, and to see the options in your life. The term that best relates to this part of the brain is cognitive flexibility. When there are problems in the anterior cingulate gyrus, usually caused by a lack of the neurotransmitter serotonin, people become unable to shift their attention and become rigid, overfocused, and cognitively inflexible. Along with shifting attention, we have seen that cooperation is also influenced by this part of the brain. When the anterior cingulate gyrus works in an effective manner, it is easy to shift into cooperative modes of behavior. When there are anterior cingulate problems, people have difficulty shifting attention and get stuck in behavioral patterns that are ineffective. They are often uncooperative and difficult, or stuck in their own mindset. The anterior cingulate system has also been implicated in future-oriented thinking, such as planning and goal setting. When this part of the brain works well, it's easier to plan and set reasonable goals. On the negative side, difficulties in this part of the brain can cause a person to see fear, predict negative events, and feel very unsafe in the world. When the anterior cingulate system is abnormal, people have a tendency to get stuck on things, locked into things, to get the same thought in their heads over and over. They may become worriers and continually obsess. They may hold on to hurts or grudges from the past. They may also get stuck on negative behaviors or develop compulsions, such as hand-washing or excessively checking locks. One patient who had difficulties in this part of the brain said it was like being on a rat's exercise wheel, where the thoughts just go over and over and over. Another patient said, "It's like having a reset button that's always on. Even though I don't want to have the thought anymore, it just keeps coming back." The clinical problems associated with the anterior cingulate gyrus include obsessive-compulsive disorder, eating disorders, addictive disorders, and oppositional defiant disorder. These disorders are associated with problems in shifting attention. There are also a number of subclinical patterns associated with abnormalities in this part of the brain. The word subclinical refers to problem traits that do not reach the same level of intensity as a disorder, but still cause difficulties in a person's life. Examples of these subclinical anterior cingulate gyrus problems include worrying, holding on to hurts from the past, cognitive inflexibility, automatically saying no, and being rigid. Temporal lobe functions. The temporal lobes, underneath your temples and behind your eyes, are frequently forgotten in psychiatry, and rarely talked about in clinical settings outside of temporal lobe seizure disorders. Yet the temporal lobes are an amazing part of the brain, personality, and perhaps even religious experience. They are largely responsible for processing memories into long-term storage. Damage here can cause amnesia. And they help you recognize the people you love, along with those you'd like to forget. The temporal lobes have been labeled the interpretive cortex because through an almond-shaped structure called the amygdala, they help you take in and integrate the current world based on your past experiences. The amygdala receives information from the senses, integrates it with past knowledge, and sends out signals for the body. When the amygdala fires appropriately, we tend to react to the world in a logical, thoughtful way. When it is overactive, we tend to be too reactive to the situations in our lives. And when it is underactive, we tend to act inappropriately. The dominant temporal lobe, usually on the left side for most people, helps us understand and process language. It's also involved with memory formation and the retrieval of words. In our clinical experience, we have seen that the temporal lobes are involved with mood stability and temper control. The non-dominant temporal lobe, usually on the right side for most people, has been reported to be involved in reading facial expressions, getting the sense that someone is happy, sad, interested, or bored, reading vocal intonations or sounds. It was the tone of your voice that made me mad, and processing rhythm and music. It has also been implicated in visual learning, such as learning through seeing how things are done. In addition, the non-dominant temporal lobe has been associated with religious experiences, such as flashes of religious intuition and spiritual experiences, such as the one the Apostle Paul had on the road to Damascus. Temporal lobe problems have been associated with aggression, directed toward either others or the self, in suicidal thoughts or actions. One of the most important insights from our work has been the association of violence with left temporal lobe abnormalities, including dark, violent, or evil thoughts. Many of our patients who exhibit violence, murderers, arsonists, spousal abusers, rapists, bombers, and so on, have left temporal lobe abnormalities. We have also seen a correlation between temporal lobe problems and sensitivity to slights, mild paranoia, reading difficulties, and emotional instability. The temporal lobes have also been implicated in problems with facial recognition and social skill struggles. In addition, it is clear that temporal lobe problems have been seen in memory problems and are the most consistent findings in amnesia and dementia. Unexplained headaches or abdominal pain are also common in temporal lobe abnormalities, as are periods of anxiety or fear for no particular reason. Abnormal sensory perceptions, visual or auditory, feel of déjà vu, or moral preoccupation, periods of excessive writing, and seizure with problems in this part of the. The soul's